The Affordable Care Act went into effect January 1st.
Really, it's unconscionable for the richest nation in the world to have 48 million people who don't have health insurance. The Affordable Care Act gets us partway there. It starts us down a path.
And it's been a mixed bag of results and reactions.
We are heading full bore into a two-level healthcare system, from the haves and the have-nots, and we've never been that way as long as I've been in it, which is over 40 years.
Hospitals in rural communities are affected differently by the program.
It's not a health reform per se, it is really just health insurance reform, meaning more people have access to health insurance. That's a good thing for hospitals and providers.
Nearly 2 weeks of new health insurance policies, what it means for you and the healthcare system. This is Arizona Week. More than 1 million Arizonans do not have health insurance. Since open enrollment began in October, about 3,600 people have signed up. A slow start, but it's a step in the right direction, says Dr. Daniel Dickson, a professor at the University of Arizona's Mel and Enid Zuckerman College of Public Health. He helped draft the health workforce provisions for the Affordable Care Act, also known as the ACA. Let's talk about why you feel so passionately about the uninsured American having access to some form of health insurance.
Well, I've practiced family medicine for 30 years now, and for most of those 30 years, half of my practice has been serving people without health insurance. And from my own practice and my own patients, I've realized that people do much better as far as health outcomes if they're insured.
Is the Affordable Health Care Act long overdue?
Well, the Affordable Care Act gives us the opportunity to address some long-standing challenges in our health system in the United States. The issues of covering the 48 million without health insurance. Issues like narrowing the health disparities that we see, the poor health outcomes for people that don't have health insurance, or the people that live in rural areas, or the people from minority populations. The Affordable Care Act gives us some tools to be able to address those chronic problems of getting people access to high quality care.
To be fair, though, there are millions of Americans that we've seen that have lost their insurance under this program. And on that note, there are naysayers out there who disagree with it. What do you say to them?
Well, when people talk about some of the challenges that we've had, I try to get back to the issue of what can we do pragmatically to move forward. We started with 48 million uninsured. Already I mentioned the two aspects, that we have 4 million people who will be covered now newly through Medicaid. Another 2 million so far that have signed up. It's expected that about 6 or 7 million people will be able to get coverage subsidized through these new marketplaces. There's another 3 million people who have already been covered through their parents' plan, one of the provisions that started from day one in 2010 of people could cover their own children up to age 26 on their own plans, and already about 3 million parents have covered their children that way. So we're almost up to 10 million people who are uninsured who have signed up. There is a group of people who have been purchasing individual insurance, what's called non-group health insurance. And it looks like that number is around 4.7 million people who their plans didn't meet the essential health benefit standards. In other words, they could be dropped if they got sick. They could be denied coverage if they had a pre-existing health condition. They didn't cover certain types of services that are required now under the Affordable Care Act. And many of those people received notices that their plan wouldn't qualify. Now, about half of those are eligible to extend that coverage for another year. The remaining half, about 60% of those, are able to get a subsidized premium that they can buy on the marketplace or be covered by Medicaid. So it turns out that it's a very small number of that 4.7 million who actually had coverage that lose it. Some estimates are that's about 10 or 20,000 people. But you compare that number to the 48 million starting out who were uninsured, it kind of pales in comparison. So I think there's choices for those folks. That's one of those issues that was addressed through the regulatory process. It didn't require new legislation. And I think we'll see those types of issues as challenges come up or as problems are identified. It probably won't be through new legislation. It'll be through the regulatory process of the legislation that's already been passed.
Okay. Dr. Dickson, are there any other thoughts that maybe you would like to share with people who are watching this and still deciding how they feel about the Affordable Care Act?
Well, I think what's lost in some of the cacophony of this partisan rhetoric is really a pragmatic approach, that really it's unconscionable for the richest nation in the world to have 48 million people who don't have health insurance. The Affordable Care Act gets us partway there. It starts us down a path. It's a path that leads us in directions sometimes that don't necessarily lead us forward. We have to keep pushing for that to get better. So I think individuals who are interested should engage in improving the process. But we can't ignore it any longer. We can't just put aside those health outcomes that we know are poor for an uninsured population. We can't, I don't think, tolerate or accept a system that really generates the health disparities that we see, where we see poor health outcomes in Hispanic, Latino, Native American, American Indian populations. That's really not acceptable. Part of that is because the uninsured rate in Hispanic, Latinos, and Native Americans is 3 times the uninsured rate of the non-Hispanic white population. So when you have 1 out of 3 Hispanic Latinos in Arizona without health insurance, and we have about 1.2 million uninsured in Arizona of our 6.5 million population. Of that 1.2 million uninsured in Arizona, 600,000 of them are Hispanic Latinos. So we have to address those issues. We can't ignore that we have some challenges to overcome, and now, through the Affordable Care Act, some opportunities and the tools and to address those long-standing health disparities that really affect and are responsible for the poor health outcomes we see in those populations.
It's too early to tell how the ACA will affect small hospitals. In Sierra Vista, there's hope and action to increasing staff size in preparation. Dr. Dean French, the CEO of Sierra Vista Regional Health Center here in Sierra Vista, the Affordable Care Act took effect just a few days ago. How is it working here so far?
Well, so far, we really aren't seeing much impact. The enrollment, as everyone knows, has been bumpy, and the enrollment numbers are, frankly, a little lackluster. So we're not seeing any direct effect at this time in Sierra Vista from the ACA.
As time passes, do you anticipate any changes, maybe an influx of patients?
Well, the hope of the ACA is that it will provide more people with access to health insurance. That, we think, will bring more patients to our facilities seeking care. It's early in the process to know exactly what that impact will be, but right now the impact on us is those patients that don't have health insurance who seek our care often late in the clinical course of whatever their disease process is, which frankly leads often to tragic results, more costly care. So our hope is with the ACA and more people having actually the ability to enroll in commercial insurance or through the Medicaid expansion, having Medicaid services, that will provide them access to primary care and actually decrease the impact on us, particularly in our emergency room.
As a family physician, you feel very strongly about people having access to care.
Yes, without it, what happens is their only choice, their last resort is to use the emergency room for care. The emergency room is not designed to manage chronic illnesses. It's not designed to prevent illnesses. It's really designed to treat acute issues. And so people come to us late in the game, and they're often quite ill, and often with diseases that could have either been prevented or treated much earlier in the course with much better outcomes.
Opponents of the Affordable Care Act are concerned that this will put a strain on facilities. This is a smaller facility than those, for example, in Tucson or in Phoenix. Do you anticipate any strains? Are you prepared for that?
One of the things that regional care is looking at in Sierra Vista and is committed to in coming here is increasing the scope and availability of services in the community. And that is somewhat predicated on a successful ACA rollout. So as a hospital, we view the ACA as a positive thing. It will afford the citizens of our community access to care, insurance that is focused on wellness and prevention, and it allows us the ability to build a new facility in the city that will have broader array of services. We're recruiting 20 physicians to Sierra Vista over the next 15 months so that we can broaden the scope of services. And that is predicated largely on the fact that we do think there are going to be more people in the community that will be seeking care and in a more appropriate way, earlier elective care rather than late-term emergent care.
Let's talk about that community. You do service rural communities in the area as far south as Douglas, Tombstone, Bisbee. Describe what that demographic looks like, and do you anticipate more of those folks coming here?
Well, the demographic varies somewhat markedly by community. Certainly there's a larger uninsured population on the border in communities like Douglas than there are, for instance, in Sierra Vista, where there's a larger community of military retirees and military personnel. So we have a very diverse population that we service. I think the communities like Douglas, like Bisbee, like Tombstone are really going to benefit from the ACA. And one of our challenges as a hospital is working with partners in those communities who provide primary care in the community. You know, Douglas in particular has a strong community health clinic, but their hospital right now is struggling, and we're wanting to see that hospital be a success so people have early access there in their community to primary care, and that in our facility we're there to service as a secondary or tertiary care center for Douglas. That population down there needs that, and I think that's where we're going to see the largest enrollment in both the Medicaid expansion and in the exchanges.
Do you believe that the Affordable Care Act is on the right track for this particular facility and its mission?
Again, early to tell, but I think the Federation of American Hospitals, the American Hospital Association, and Sierra Vista Regional Health Center all agree that more people with health insurance, whether that's Medicaid, Medicare, or commercial insurance provided through an exchange, is a much better position for us to be in than patients presenting to us in our emergency room with no means to pay. That just passes costs on to other consumers who do have health insurance. It's a cost shifting model that's inefficient. It's hard on our patients, and it doesn't promote community health and wellness. So overall, you know, the ACA really is just health insurance reform. It's not a health reform per se. It is really just health insurance reform, meaning more people will have access to health insurance. That's a good thing for hospitals and providers.
It seems like quite a feat to hire so many physicians in such short period of time. Are you concerned about the challenge that is coming your way to fill that need, as you said?
Well, we've very carefully looked at what the services in Cochise County are and are not, and looked at our current providers and sort of walked through and selected what we think we need to meet our needs for the next 5 to 10 years. And so it's a thoughtful process. Is it a challenge? Yes. I mean, we're in competition with communities across the country. I think Sierra Vista in Southeast Arizona has a lot to offer. And for a new physician coming out of training or a physician who's in mid-career, Sierra Vista is a great place to live. And I think in some ways, it's an easy place to recruit to. We have a great hospital. We have a great community. It's a stable community with a good economic base. And we see opportunity galore here. So I'm very optimistic that we'll get the doctors recruited.
Further southeast in Bisbee, where the hospital is much smaller, and there the CEO isn't sold on the new health insurance policies. Jim Dickson, the CEO of Copper Queen Community Hospital here in the Bisbee area. When I tell you about the Affordable Care Act, what are your immediate reactions to how it impacts your facility?
As of this point, not at all. We haven't seen any expansion in Medicaid. We haven't seen any expansion in the insured people. There's one navigator for the whole county. So we have not seen any impact. As a matter of fact, we have seen the free care, the charity care, go up 50 or 100% over the last 2 years. It's just not impacting yet in this area. And also, it doesn't bring extra physicians. We're in a medically underserved area, healthcare professional shortage area, and it doesn't give us more doctors. So our task is to treat these people who now have insurance, but we're treating them now already.
Let's fast forward a few months when people have health care who didn't have health care before. What do you envision this facility looking like?
Well, our demand, we've grown at 20% per year for the last 4 years because we changed our delivery system to meet the needs of the community. And we're growing like no other hospital system I know. Our revenue for the first 5 months, our volume of care went up 20%. Yet it only increased our net revenue by 8%, and the cost to do it was 10%. So we're seeing our bottom line erode with more volume. And that's what's going to happen. You can't sell a car and lose $1,000 and then sell 100,000 cars and think you're going to make money. It's going to cause the hospital, and then what we do is transfer the cost to the insured. It's a hidden tax. All hospitals do it. It's no secret. So you're going to see it hit in your premiums, and you're going to see it hit in your cost. And that's basically the bottom line. Now, we've tried to change our delivery system. We put in the rural health clinics to give people access. We brought in telemedicine so that they can see their specialists and not use the ER in that. We brought in telemedicine to use in the hospital so we don't have to transfer people. And in Douglas, we're opening up what we call a quick care, where people can come in and instead of going to the emergency room, go to the quick care. But it's not an urgent care because this has all the diagnostic capacity, radiology, laboratory, and that you would see in an emergency room. It's like a urgent center on steroids.
Is there anything about the Affordable Care Act that you do like, that you do envision having its place?
I think some of the things are good, but it's too much too fast. There's not enough flexibility in the system to change that fast, and it's a political war. It puts more of our care in the political arena. That's what happens when the government assumes health care. They turn around and, oh, we're short budget this year, so we're going to cut out health care. We're going to cut out some programs that help people. If Washington gets a flinch, like they just did in the last Budget Act, they will take away money from us to fund defense. And so it comes down to that type of political, and I don't think health care should be political. I think everybody should have a right to health care, reasonably cost, but I do believe a competitive system is better than an over-regulated system. I believe that people doing this should do that, although it has not proven fruitful in the long run.
Will the Affordable Care Act help or hurt this hospital financially?
Neutral.
Okay.
It's neutral. It will not help us financially because they're paying us less than our cost. We had one insurance exchange come in and said they wanted to pay us 20% below the Medicaid rate, which is 60% of our cost. So if you render $1 worth of care and they pay you 60 cents, they wanted to pay us 40 cents. And that's not what we charge, that's what it costs. We get these costs from Medicare and other places. And so I don't think it's going to help us anyway in rural America. It might help in urban America, but I don't see rural. See, this is the one-size-fits-all mentality that the ACA has. It doesn't fit all. You have different systems and different needs in different parts of the country, and the economic system varies that to the market. And so we need to be variable to meet the patient's needs. We've got diabetes, COPD, CHF, congestive heart failure, and that kind of stuff. And so that definitely needs to vary according to the market you're in. It can't be one thing from Washington. It just doesn't work that way.
Governor Brewer was very upfront about her believing that this would expand Medicaid. Do you disagree with that?
I disagree in the length of the time that it will span Medicaid. I do not like to get on the governor's bad side. I've been there. The fact is that it'll be a 2-year expansion, and she's taxing the hospitals to do it. So not only do you get paid less than your cost, now they're going to take whatever extra money you have to buy equipment to fund the cost of the expansion. Now, if you're a large hospital, like TMC or UMC, you're talking millions in high volume. When you're a small rural hospital, it doesn't work. We don't have that volume. We can't transfer that much cost. So I would say to you that I think she's wrong that it'll expand Medicaid, but for a short period of time. And what good is that? What I'm most afraid of is that a lot of the good upper level carriers, such as Mayo, Cleveland Clinic, and that, are opting out of the exchange system. They probably don't take much Medicaid either. We are heading full bore into a 2-level healthcare system, from the haves and the have-nots. And we've never been that way as long as I've been in it, which is over 40 years. You treated everybody equally, you took care of them the best you could, and you did it. Now, if the economics weren't there, you ate as much as you could, and then you just had to stop. But the fact is that by having such a discrimination between this group of Medicaid and exchanges with bad programs, and then your upper level people having Blue Cross and everything nice about it, we are developing a 2-tiered medical system, and that's what the ACA is accelerating.
And here to talk about the overall picture for the state is Greg Vigdor, the president and CEO of the Arizona Hospital and Healthcare Association. Greg, thanks for being here.
Great to be with you.
Let's talk about how the Affordable Care Act has been received so far, just in effect for a few days now. Are we seeing any successes, any glitches?
Well, it's really too early to see much of anything in terms of the health care delivery aspects of it. People have been trying to enroll, as we know, for a few months. And technically, the law just went into effect January 1st for a lot of folks, but really we're not seeing many healthcare implications yet. I think the good news is that the rollout went a bit smoother in Arizona than the rest of the nation, primarily because we were doing a lot of efforts to bring people into enrollment in the new Medicaid program.
I see. Let's talk about that Medicaid expansion. You've said this is about human need. Can you describe why you feel that way?
Sure. Governor Brewer made the excellent case that we agreed with completely, that the numbers really justified the action we took with the state legislature. My point was, in addition to that, there's a great human need to making sure that our neighbors and our friends and our family members have coverage, that the wrong way to get your health care and the wrong way to find financial security from any illness that you might have is really just to wait and see what happens without insurance. So this is the humane way to deal with this.
And in the past, you've said this makes financial sense for hospitals. Can you describe for people at home what exactly that means?
Sure, it's all relative. The starting point to this is the healthcare financing system in this nation doesn't make much sense. What is making sense in the new law is the probability that we're going to be able to lower uncompensated care costs for hospitals. That's the cost that we bear because of people showing up without coverage that we then have to have other people pay for, and it makes for a really unfair system. And by expanding Medicaid, restoring Medicaid, we're able to really lower those costs is what we're projecting, and that should be good for everybody.
There is some concern from opponents who say that healthy people who are insured will end up picking up some of those costs. Describe to those opponents what exactly that means. Will they be picking up the costs? There are some hospitals who feel the same way.
Well, that's the nature of insurance coverage, is really you're going to pool costs. The real objective is to make sure that those really unanticipated catastrophic events are really taken care of. People aren't bankrupted by the nature of just having a problem up there, but for the grace of God go I. And so we are going to see some level of that. I think the real policy wonks will get into how much of that cross-subsidization is going to happen between healthy people and sick people. And different people will have different views on whether that's fair or not.
Arizona is unique given that our proximity to the border is part of our geography, our demographic. We spoke with the hospital CEO in Bisbee, who's concerned that the ACA doesn't quite benefit rural communities because he describes it as a one-size-fits-all mentality. Do you agree with that?
Well, I don't know if it's one size fits all, and I think like most of the Affordable Care Act, there's a lot of wait and see. Potentially, we're going to see some benefits for rural areas by having more people covered, just like I was describing. But on the other hand, we know our rural communities are really in jeopardy because of low numbers of patients. And it is quite possible we're already seeing some problems out there in terms of health coverage that's being offered to people where the local hospital, local physicians are not in the network. That's a serious problem and one we're going to have to tackle.
How do you anticipate tackling that? The hospital in Sierra Vista says they plan to build a new facility and hire up to 20 new physicians in the next 15 months. Are you seeing other facilities take on those types of feats to fill this role?
Well, I think there's going to be a lot of different market responses to what gets done. I think there will also be a fair amount of regulatory and other responses to try to make the act work. It's a work in progress, and there's going to be a lot of work that needs to be done both locally, at the state level, and at the federal level.
As the head of the Arizona Hospital and Healthcare Association, what do you see as the biggest challenge coming for the Affordable Care Act? What needs to change to make it better in the early stages?
Well, I would start with the patients, and one of the things we need is to make the whole act more people-friendly. We've seen some of the problems in the rollout of the website. We've got to do a better job as a state and a nation in really making it work better for people, more understandable, more transparent. From the provider community, I think we're also looking for some more stability, some more consistency in the rollout dates, less work by Congress behind the scenes to add additional provider cuts. It's already a tenuous job for our providers, our hospitals, to try to make this work, and we're just going to need some greater clarity and consistency in federal policy.
It's only been in effect for about 10 days now. Moving forward, what are some of the short-term goals that you would like to see happen?
Short-term goals for the Affordable Care Act?
Yes.
Again, I'd go back to, we just got to make this work better for people, make sure they're understanding their choices better, and that we're doing all we can first for them, and then really trying to find the policy problems and fixing them.
There are up to 4 million people that we've heard about who have lost their insurance coverage because of the ACA. What do you tell those people who may be watching?
Well, we've heard a lot of people say it's a bad idea, but I think it's really incumbent upon them to come up with an alternative solution, not only one in theory, but one that has some chance of being implemented into actual law. The job of our hospitals and our providers isn't to decide red state, blue state issues, it's actually to take care of people. So from our point of view, our job is to implement the law as best we can in the best interest of the people, patients, and communities of Arizona. And what I'd say to opponents is they're just going to have to come up with something that's different, that really has a chance of replacing this law, or this is what we have to work with, and we got to make it work.
Greg Vigdor, the President and CEO of the Arizona Hospital and Healthcare Association, thank you so much for your time.
Thank you.
And that's our program. Join us next week as we sit down with Arizona Governor Jan Brewer as she lays out her plan for the year in her State of the State speech. For all of us here at Arizona Week, I'm Lorraine Rivera.